Conventional and alternative, traditional and non-traditional, science or quackery. These terms are often bandied about in discussions of healing practices not endorsed by institutions of medical authority. But a 1990 study reported in the New England Journal of Medicine estimates that nearly 1/4 of all Americans has, at some time, used alternative therapies to treat a medical condition. Now, traditional medicine is starting to take notice. Missoula, Montana's Institute of Medicine and Humanities explored the connections and conflicts between conventional and alternative medicine in a conference of information and dialogue. This public conference brought together conventional medical practitioners, medical historians, and alternative practitioners in naturopathy, biofeedback, chiropractic, acupuncture, and massage therapy, as well as patients who have made use of a combination of these therapies.
It's time to take off the armor, stop being defensive, and share information and treatments for the benefit of our patients.
Here is that discussion.
So before we begin, I'd like everyone to stand up. And what I'd like you to do is to take your hands, put them together, and rub very vigorously. Try and build some heat in your hands. Now, begin to rub your forearm, just one forearm. We're going to do one arm at a time. We'll get to both. And you might even want to rock back and forth on your feet to put some movements into your body. Go up to your upper arm. Again, rub very vigorously, put some heat in there. Rub hard. Go up to the shoulder, back down to the forearm, down the arm. Let's do the other arm now, to the forearm. Rub the upper arm, rub the shoulder, back down to the forearm, back down to the arm. Now, take the pads of your fingers, not the tips, but the pads, and begin massaging and rubbing back and forth on your face, on your forehead. Now, go onto your face and even take your whole head and put your whole head into it. And go back up to the forehead. Now, V your fingers, put one finger in front of the ear and one finger behind the ear. Rub yourself behind the ear. Okay, and rub your face again and in your forearm. Now, shake your arms out a little bit. Shake your legs out a little bit. And sit back down. I think that's all I need to say. We just did a form of self-massage. Your skin might be a little red. We've dilated the capillaries and put a little bit of increased circulation into your body. We've also, the friction that we did generated a little heat, which also can have a therapeutic effect. We've released the metabolic waste products that accumulate in the tissues through that increased circulation. We've also stimulated the immune system through the inflammatory response by increasing the amount of histamines in our body. If you would have continued with this work, a couple of stress-inducing hormones, cortisol and norepinephrine, those levels would have decreased, which hopefully would help you feel a little bit more relaxed and alert. So hopefully now you feel a little bit more relaxed and a little bit more alert. Also, sitting for more than 30 minutes at a time is just not healthy for the body because that increases the neurological activity in the body. And what happens is that when you have what the body wants to do is to maintain a low level of neurological activity, what we call tonus. And as a general rule, the higher the tonus, or the hypertonicity, the greater the amount of pain that can be in the body. And it's important for me as a massage therapist to know that, to know how the nervous system works. Because not only is massage therapy a physical experience, an emotional experience, it's also a physiological experience. But first, however, before we get into that a little bit more, I think it's important for us to know what massage therapy is. The field of bodywork and massage therapy is so broad that we've had a very difficult time defining it. Attempts have been made in medical dictionaries and in state legislatures throughout the country. However, in all of these contexts, that definition is just not broad enough. For example, therapeutic touch, which was pioneered by Dolores Krieger, a nurse, and in fact many of you nurses may be familiar with her work, doesn't fit the standard definition. That standard definition of massage usually includes some sort of jargon that has to do with kneading or otherwise manipulating the soft tissue. Yet therapeutic touch may not even bring the practitioner into physical contact with the body. So, that's why I also use the term bodywork, is because many of the techniques that we as body workers and massage therapists use may not fit that standard definition of massage. So, in 1991, a group of body workers got together and decided that rather than talk in terms of definitions, that they talk in terms of a scope of practice. And this is what they came up with. What this model does is group massage therapy into three broad-based paradigms or uses for massage therapy. According to this model, each level builds on the next. So for instance, a practitioner needs the least amount of training to do relaxation massage, the next amount of training to apply massage in the remedial care setting, and then the most training in order to address the whole person. It also implies that holistic massage encompasses remediation massage, which can encompass relaxation massage. Relaxation massage focuses on the well-being and looks at massage therapy as a personal service for wellness and for preventive care. This level of practice is based on the human biological need for safe, nurturing, non-threatening touch. And as mentioned here, the focus is on stress reduction and relaxation. The second paradigm, remediation massage, focuses on correcting the human dysfunction and the remediation or alleviation of pain. Many practitioners call it clinical or medical massage. Holistic massage focuses on improving, enhancing, balancing, transforming the quality of life of the individual. And to enhance the individual's tendency, the natural tendency of the individual's body, mind, spirit, emotion, to seek a higher level of functioning and well-being. Now, as implied by this paradigm, there can be physical changes in the body or the remediation or alleviation of pain in the holistic model, but it's not the goal of that particular paradigm. There are more than 100 techniques of bodywork and massage therapy, and within this model, they're grouped into what they call 5 approaches. I'm not going to address those 5 approaches today, but for our purposes today, I think that it's important for you to know that almost every one of those 100 techniques can have an application within each of these paradigms. In my experience, however, I find this particular model to be somewhat incomplete. In Montana, and in Montana particularly, because there is no regulation, there's no licensure, no certification or anything having to do with regulation in massage, and therefore there's no uniformity of training of the practitioners, I find this 4th paradigm, which I call holistic with an H. And with these particular practitioners, they're working with the whole person, but they may not necessarily have the skill level to do the remedial care work or to address fully the physical problems going on in the body. So hopefully out of this model you can gain an appreciation that it's extremely difficult for me to limit my comments to 20 minutes, much less give you a complete and thorough overview of each one of these paradigms in the time allotted. I'd also point out that because we are discussing such a wide and broad and diverse field, that I can only speak from my perspective. Another massage therapist with different training may have a different view and maybe a contrary opinion to mine. So, Today, however, because this is a medical conference, I think that it's important that I narrow my scope of my view of looking at things today. So what I want to specifically talk about is massage in the remedial care setting, or clinical massage. And to even narrow it a little bit further, what I want to do is look at clinical massage as a hands-on modality, somewhat typical of what's taught in most massage therapy schools today. So why do people choose massage therapy? Why do they choose it? Why do they come? People have a variety of reasons for doing that. It may be because they want to relax a little bit, reduce their stress, and so on. But for the most reason, the reasons why people come to me for clinical massage, and I think it's almost true with any care, alternative care, is that number one, pain is a great motivator. And number two, massage therapy is effective. It works for them. Pain is a great motivator. I want to look at these two things in a little bit more detail. Pain is a very good motivator for people because with the emergence of patients' rights, people are no longer willing to accept that they'll always have pain, that they'll always be in pain, that they have to live with their pain. And they'll seek out whatever they can do in order to alleviate that pain. Typically, when someone comes to me for clinical work, they've already exhausted their other options. They've been to the doctor, they've been to the physical therapist, they've tried medications, and they just have not gotten relief from their pain. They've ruled out all the usual medical causes for their pain, and nobody knows why they're still in pain or they haven't been able to alleviate it. And they're willing to try anything in order to help themselves. The second reason why people seek out massage therapy is because it's effective. Again, I can only speak from my perspective on this, and another massage therapist might have another view of this, and might even be very different. They might even disagree with me, but here's my bent on the question. First of all, and some of the people who've talked this morning have alluded to this, the most successful clients are the ones who take responsibility for their own healing process. This means that they actively participate in their process and that they understand that they're the one who is in control of their own healing process. This may include making lifestyle changes. It may include changing that belief about who's in charge here. In essence, attitude is everything. And the medical community is further researching this link between the emotional states and the mental states and the body. And several people have made references to psychoneuroimmunology, which basically, for those of you who don't know, is the connection between the psycho-emotional states, the nervous system, and the immune system. Now, the muscular system, which is what I deal with, is specifically linked to the nervous system. It's a slave to the nervous system. And what happens is that basically what that means is that the nervous system totally controls the muscular system. It only makes sense then that the psycho-emotional states can have a profound impact on the muscular system. How that client approaches their own healing can make a tremendous difference. And in addition, touch research is showing that touch can and does have a tremendous effect on the emotional well-being of the individual, such as reducing stress and reducing depression. Secondly, we're asking the client to be fully present in their body. Now, that may have just sounded like a very New Age statement and something very typical of what you get from an alternative healthcare practitioner. But I think that it's important that we look at that statement in its most fundamental form. For those of you who don't know what this is, for most of you hopefully this will look familiar, but for those of you who don't know what this is a reflex arc, a sensory motor reflex arc, which basically describes how the nervous system works. As I said before, the muscular system is a slave to the nervous system. How movement and muscular contraction occurs is due to this sensory motor feedback loop. An input occurs, such as a child sensing that they put their hand on a hot stove, on a burner on the hot stove. And then the information is processed, and then a motor response occurs, pulling that hand away from the burner. Now, the motor response that comes out can be up to 10 times stronger than the sensory input. And this is very, very significant, particularly in an area of trauma, because what happens is that that stronger motor response can cause more pain, which can cause an even bigger sensory input, which can cause an even bigger motor response, and so on. So that as that continues, what will happen is it will develop into what we call a vicious physiopathological reflex arc, which some of you may have heard about. And in essence, what happens is the pain escalates and the pain spreads. Because this system, this sensory motor system, is a closed system, in order to change that motor response, and basically motor response is how the muscles move, we have to change the sensory input. And because massage therapy is such a sensate experience, it directly affects the sensory motor feedback loop. Through trained, intentioned touch or pressure, we specifically do three things. One is that we introduce a new input into the system, which interrupts the afferent or the sensory impulses, which changes motor response. Secondly, we reduce the intensity of the nervous activity within that tissue. And thirdly, we mechanically, through touch, rubbing, we mechanically force out the toxic irritants that accumulate at nerve receptor sites, which cause the pain. The result is that the muscular contractions are released and the trigger points are eradicated. Those little guys right there, original trigger points. Okay? And in addition, depending upon the skill level and the training of the practitioner, they can assist that client in learning how to control the motor input over an area by learning how to vary that sensory input on their own. In essence, learning how to feel, which can keep that problem from recurring, which can keep it from coming back. I also specifically say trained touch, because massage therapists are the only practitioners, and I emphasize the only healthcare practitioner that are specifically trained in the various types of touch and how they affect the body. Trigger points are also an interesting phenomenon because that massage therapy also directly addresses. Massage therapists are now studying the work of Drs. Janet Travell and David Simmons. And in myofascial pain syndrome due to trigger points, Dr. Simmons states that trigger points begin primarily as neuromuscular dysfunction resulting from muscle overload. He further states that massage is a therapy of choice for treating trigger points. Trigger points essentially refer pain from one area of the body to another. So for instance, when Jan this morning was talking about headaches and she was mentioning hooking up to muscles, trigger points can be in the shoulder and in the neck and refer pain into the head, thus causing headache pain. And massage therapy can eradicate those trigger points. The third reason why massage therapy is effective is because we look at most dysfunction in the body as being a functional and not structural problem. For example, someone may have been diagnosed with low back pain. A structurally oriented practitioner may look and see that the pain is caused by a compressed disc at L4, L5, very similar to what Don was just speaking about a little while ago. My first inclination when looking at this problem is to look at what's happening functionally in the body. What are the muscles doing? How are they moving? How is the body not moving? What are the habitual contractions in the body? Where are the holding patterns in the muscles? And very similar to what Don was talking about, we look at how the structure is, front and side. And so what happens is that what I may find when I work on the body is that I might find that there's muscles in the back that are causing the tightness here that's causing the compression. When I release those muscles, the pain goes away. Or I might find that the psoas muscle, which is a deep belly muscle, and the lower leg contain what we call trigger points, which refer pain into the low back area, which when I release those particular muscles, alleviates the low back pain. Or again, I might find that the low back pain is alleviated when I release those muscles in the lower leg, the back, the psoas, and the anterior neck. I might find that the low back pain goes away. I find that when I release habitually contracted muscles and teach the person how to stand correctly, that structure changes. By retraining the neuromuscular system, structural changes do occur. Very much again like what Don was talking about, where maybe that military neck might change because we're changing the muscles and how they pull on the bones. So for example, another example might be, particularly with the low back pain, is that anteriorly rotated pelvis that might be causing the pressure back here returns back to its normal position. Again, I'm not a diagnostician, so I can't diagnose any of those things. All I can do is work with the muscles and see what happens, and see how that affects the body. What I've presented today is just a thumbnail sketch of one view of massage therapy. So let me leave you with a final note here. Of the $1 trillion that will be spent on health care in the United States this year, 64 billion of that, and that's billion with a B, 2/3 of that $1 trillion will be spent to alleviate the pain due to ischemia. Ischemia simply means it's a term that simply means a lack of blood flow to an area. And massage therapy is specifically designed to address ischemia, to alleviate it, to change ischemia. And yet we as practitioners are underused in this country. Of all of the developed countries, the United States is the only one that does not have massage therapy fully integrated into its mainstream medical health care model. And in my estimation, that's costing us billions of dollars each year. Alone or as an adjunct with other therapies, massage therapy not only treats a variety of soft tissue dysfunction, particularly chronic pain, the pain from whiplash, fibromyalgia, low back pain, any muscular pain, most muscular pain. In most instances, it's much more cost-effective than conventional treatments. Massage therapy may reduce the need for medication, for pain and/or inflammation, prevent surgeries, correct postural dysfunction, and remediate the pain due to soft tissue injury. It's my hope that further educational opportunities such as this will occur so that the door may be opened to begin utilizing and further researching those healthcare modalities that are in the best interests of our clients and patients. I'm looking forward to a continued dialogue, and I thank you again for your time and your attention.
When Stephen asked me last summer to moderate this last discussion, he told me it's probably the most dangerous job that there is. But actually, I was very pleased to take it on. And having agreed to do it, I started asking friends as I met them this summer if they ever went to a chiropractor, a massage therapist, anyone practicing really alternative medicine, if you will. And it was most interesting to hear people's response. What I found is that a great many, in fact a majority of people whom I talked to indicated that yes indeed, they did, on occasion at least, seek out alternative medical practitioners. Some of those people said, "No, I would never tell my doctor this, though." And someone in the audience had talked about lying to doctors, and I had someone just recently indicate to me that they always lied to their doctor about what they actually were doing for themselves. I grew up in a home, and just so that my prejudices are out, I grew up in a home where there were 12 children. My mother was an RN and had taught in the School of Nursing. And she had a healthy, believe me, healthy respect for the medical profession. At the same time, she was also a bit of a skeptic, and I know there are some doctors in the audience who treated her and who used to say, "Martha, you're your own worst enemy," because she'd periodically disagree with their diagnosis, their medication, etc. of her. What we are going to do today is to end this program is really to give you the opportunity to ask questions of our practitioners. I, however, get to raise the first question. And what I want to do is simply make a comment based upon what I've seen here today. This particular conference was billed as a conference providing information and generating some kind of dialogue. And really what I've heard from this morning until and through the last panel was really great information, I thought. I learned a lot. I'm a tax professor. My area is so far removed from what folks have been talking about. But I learned a great deal from the practitioners this morning, from Dr. Savitt, and then from that wonderful patient panel which we just had. I think that what we've seen here is something that is really a freeing kind of experience. People do lie to their doctors at times about the kind of treatment that they seek out. Today's conference has enabled people to talk freely about alternative medicine, at the same time talk about, if you will, the relationship between alternative medicine and so-called conventional medicine. There were some things that I picked up just word-wise that I want to focus our attention on, and then I'll pose my first question. Someone this morning talked about turf, and I can guarantee you, having worked during the last year with healthcare reform legislation, there are all kinds of turf battles going on and that will continue to go on. And in some respects, when we talk, as someone mentioned a moment ago, conventional medicine, alternative medicine, we're talking turf, and we might just as well be blunt about it. There are folks in the audience today who probably have listened to some of the practitioners and have wanted to say BS, and vice versa. Someone mentioned the word dichotomy. There's no question that we are seeing dichotomies. On the other hand, we've heard about efficacy. And as I think about healthcare reform, we're not just concerned about cost, but we're concerned about effective treatment of patients, effective treatment of human beings. That's what this hospital is dedicated to. I think that's what, frankly, everyone in this room is dedicated to. Well, what is effective treatment? I think this morning and through this afternoon, we've heard from practitioners and patients that there is a broad world of information out there, all of which is somehow important to each of our well-being and to each of our health. And in that respect, I heard people talk about integration or collaboration or partnership. And certainly, I think the theme of this conference is one that explores that possibility of effective treatment that ties together maybe this broad range of knowledge, broad range of techniques, science, etc. Now, let me turn then to the first question. You'll notice as an attorney, I've sort of gone on and on and on and still haven't got to the question. If you can't laugh at yourself, you're in big trouble. One of the things that certainly in the professions we see are the sort of turf battles. And I think about law students whom I instruct, and one of the points that we always emphasize with them is that there are going to be times when you are in over your head, and you'd better know when that is, or times when there's simply a whole range of knowledge that you don't possess, and you need to refer people to someone else. And you need to be a professional enough to do that. You need to be ethical enough to do that. And so a question that I want to raise for our practitioners at this point, and I'm not going to call upon every one of them to respond, but I'll ask maybe Deborah and Dick and Nancy to comment on this one. To what extent is there much referral in Missoula between and among the alternative medical practitioners and between and among conventional and alternative practitioners? And maybe, Nancy, let's start with you. And in your response, I'd also like you to speak to what kind of impediments there are to that kind of referral process.
Well, I think the major impediment, I can start right off with that, is that I'm not known. The medical community does not know what I do, how well I do it, and or what to expect from me. And I have always considered that my responsibility. That's why I'm here today, to try and make myself known. I refer fairly regularly to medical doctors, probably once a month, generally speaking. I find a reason or a need to refer. My experience in reciprocation has been, in 4 years I have received 2 referrals from medical doctors that I'm aware of. That, in other words, that were done in the traditional expected way with paperwork and so forth accompanying it. I look forward to that changing. I think a very honest and real thing to say is that there is plenty of illness, distress, and imbalance to go around. There is no lack of need for all of our services. I don't think that scarcity is a problem. But just getting to know us and what we do and how we do it, and getting to know your patients, knowing someone well enough to know who might match well with them and their needs at any given time. We're all really, really busy people, and this is going to be really, really hard to do. And finances, economics are also in the way. But there's nothing to do but begin. And we can begin that by having lunch.
I, of course, do refer to physicians a lot. There are times when people come to me with physical conditions that definitely require some sort of medical treatment. And so I do refer to physicians. There are times when it's after I've released the hyperconstrictions and worked on the musculature of the body where now it's time to strengthen those muscles, so I refer to physical therapy. So I make all of those referrals on a regular basis. Also, I refer to naturopaths, I refer to chiropractic, acupuncture, and so on, so that I'm referring to a lot of different people about how my clients can get better, and so that they're not in pain. I get very few referrals from doctors. Mainly when I do get referrals, it's because people, they've got a lot of stress in their lives and they want massage to relax. But in terms of looking at the medical paradigm of massage therapy, where someone can have the musculature of their anterior neck released because of a whiplash that's been bothering them, or severe low back pain, I get few of those kinds of referrals from people. That is changing a little bit. I just received word last week that there is a doctor in Missoula who has a massage therapist on staff. So things are changing. But currently, I don't get a lot of those cross referrals back.
As far as referrals, it's actually been pretty easy for me. Usually, most people coming in, I'm typically end of the line. They've already seen 7 doctors, 4 chiropractors, 2 physical therapists, and a witch doctor before they show up. So I don't have to worry about have they been seen appropriately. I know they've had a good going over. Fortunately, acupuncture still will typically work in those situations, to the extent that then the next time that person gets sick with something similar or something different, they'll start with me, which is really where I would like to be, is at the beginning of the line instead of the end of the line. However, then that puts it more on me to know when I need to refer out. And so I think part of my job, and something I enjoy doing, is knowing whatever else there is available in the community, both through experiencing it and just knowing the different physicians and practitioners that are around. So I do a fair amount of that. I would also say that I do get a fair amount of referrals from the MDs in the community. I don't get a lot of them, but I get enough that it's a steady flow. As an acupuncturist, we're licensed by the Board of Medical Examiners. And so being licensed by the same people as the physicians, I think they have a sense that we perhaps have enough of a quality education and so on that they're willing to send somebody to us to at least see what happens. Generally, they're pleased with that, and so they'll keep that at least as an option. I find that most doctors, just like all of us practitioners, really what we want is for the person to get better. And if what we're doing isn't working, we're willing to send them to somebody else to see if that person can get taken care of.
I'd like to ask each of the panel members what you do for headache, how it works, and what your efficacy is, just very basically.
Okay, I hope everyone heard that. What you do for headache, what works, what sort of efficacy. And let's just quickly run through this panel then.
I do everything. I find out as best I can what is the cause of it, and there are, as you know, myriad causes. I use herbs, I use homeopathy, probably homeopathy and herbs most often for headaches. I often refer for massage, and craniosacral work for that particular one, or chiropractic. And I do really well with that. Headaches are pretty fun, easy.
I don't think this question is for me. I get an MRI on everyone with a headache.
So much for cost effectiveness.
I probably do about the same thing as Nan does. It starts with a history of physical, kind of divided into muscle tension or migrainous or all the other awful things that it can be. And then I do osteopathic manipulation, craniosacral. I send people to acupuncture if need be. I also use an MRI. And also homeopathic things with the naturopath that's in my office. I try and use, and also drugs too, prescription drugs.
Don.
Well, through chiropractic, first of all, we always start with a history and exam like all the other doctors do. Usually x-rays, a lot of people do have x-rays. I have them bring their x-rays in. If it's migraine type headaches, a lot of the time we're doing something upper cervical. As far as the nervous system goes, waking up with headaches, we find a lot of people with lower neck and middle back problems. I'm going to stop right here. My wife will really get me.
On advice of counsel, Don.
Chiropractic usually does very well.
Never passing on, yeah.
I don't think I can top that one. Like everyone else, I do a history. I look at whatever trauma that person has had in their life altogether, like a car accident 5 or 10 years ago. May have allowed those vicious physiopathological reflex arcs that I've been talking about this morning to develop trigger points in the shoulder and in the neck, the upper body, which can refer pain up into the head and cause headaches. So I use different techniques, and one of the comments that we wanted to make earlier, a few of us were talking about, is everybody is different, and every body is different, and not one therapy is going to work for everyone, and so each of us does our own little thing, and like I mentioned this morning, there's over 100 massage therapy techniques, and I think I've been exposed to or have had some training in about 10 of those, and so what I try to do is to find which of those techniques is going to be more efficient and more effective for that individual.
Acupuncture addresses headaches quite well, actually. I would say, if I gave numbers, it would be maybe 2 out of 10 I'm not going to do anything for. 2 out of 10 I'm going to help some, but not a whole lot. And then about 6 are going to get really pretty remarkable results. Again, I'm usually the end of the line on something like a headache, and so I do see a real variety of cases on that, and for whatever reason, it's one of those ones that acupuncture seems to address in a real nice way.
The definition that's used by the article that really precipitated all this in the New England Journal of Medicine said that alternative medicine was any therapy that was not traditionally taught in American medical schools. I'd like to suggest, and some of the things that were listed in that were things like a massage and diet and exercise. Well, massage has definitely stood the test of scientific inquiry. There are very few therapies that are more beneficial for edema reduction than massage. Diet, I don't think anyone in the room would argue the benefits of diet in health. Same thing with exercise, definitely physiological benefits to it. yet they were listed as alternative therapies. I wonder if you would discuss perhaps another definition, maybe alternative medicine being those therapies that have not stood as yet the test of scientific inquiry to have a physiological or psychological benefit, or have been shown to be more efficacious in patient treatment than allopathic medicine.
I think it's important to understand that the use in that article was an effort to collect information from a telephone interview. The average time of the telephone interview was about 45 minutes, I believe, and a great deal of information had to be collected. So this was established as a conventional methodology for designation that that may not need to have so much meaning beyond that necessarily. So I think it's just it's sort of like in oncology, for example, when we're dealing with women with breast cancer, we assign menopause at age 50. We assign it so that we can deal with the different medications that are given for people below and above 50. It's a kind of nomenclature that we use that's useful for a collection of information. So I think that it doesn't necessarily have to have all of the meanings that you would say, and I think that one of the things that we're all aware of is that this is in flux, this is changing, that there are better definitions, and that things that have traditionally been considered as alternative are not necessarily alternative, and there are things that we're doing standardly that are falling down that we're not doing and are not acceptable, and part of that is the history and the culture that we're dealing with, and so this is just nomenclature for language to some extent.
Although I do use the term alternative, I don't necessarily like that term even, and less so the term that they used in the article, which was unconventional medicine. Alternative to me implies in lieu of or instead of. And particularly with massage therapists, we want to work with all of the other kinds of modalities that are out there. So I prefer the term complementary medicine, that we complement and are an adjunct to other therapies, whether it's other, quote, natural therapies or conventional methods. As far as massage therapy fitting into that model, it's important, at least from my understanding, to look at what the steps of rehabilitation are, which is the first step in injury rehabilitation is reducing the hyperconstriction, eliminating the contraction of the muscles. That's what I do. And then the other steps have to do with other kinds of therapies, like physical therapy or whatever. So that's all I'd like to say at this point in time.
I just think it goes back to what Dr. Sabat was saying this morning, that this word conventional, non-conventional, alternative, AMA, allopathic, and all that stuff is in cultural context. And I think we've been under the culture for the last 70 years of the definition of allopathic. I don't think we have an adequate word at this point in time as a culture for what this panel is about. Then we can come up with one today.
We're moving that direction. Again, I would just suggest that oftentimes language does fail us, and we end up with the use of language that creates dichotomy when perhaps dichotomy is not what we ought to have. Next question.
I think the conference has been wonderful and frustrating for me. Wonderful because I've learned an awful lot about some aspects. I do a little more historical research now on other aspects of so-called alternative therapies. The frustration, though, is as a patient, what path does one take? And how does one know what path to take? There's so many different alternative treatments, and I don't care if you want to include what we call mainstream medicine or conventional medicine, or whatever. You can call that alternative too. You have all of these alternatives, and how do you know where to turn? What direction to take as a patient? I mean, we heard some of the patients talking about the various ways that they work. It's a bit frustrating because the system seems so, there is no system in a way, and it's very complex. So
let me ask Mary to comment on this. Mary, putting you on the spot for a moment, I was not aware of what you were doing in Arlie, and it's a pretty exciting kind of thing to think of the sort of integration that you have within your office. That may be a suggestion in terms of the path. Would you comment?
I'll take a crack at it. I think it's a struggle. There's some certain common sense things that people can do, myself as a patient and everybody else. And I referred to it this morning in that allopathic medicine is extremely good at crisis management. So if I have a car accident and fracture my femur, I don't want to go to Dick Larson. as my first line of defense. I'm going to want to go to an orthopedic surgeon. I am going to go to Dick or Nan while my leg is in a cast to get increased healing capabilities from their types of medicine. That's a real pat answer. I think the other thing how we can sort this out is a certain amount of public selection. And I also think that as medical providers of whatever nature we are at, we need to know what other people are doing so that we can inform our patients of choices out there that are other than our own.
What we really need is education for everybody from grade school on how your body works and what your choices are, so that we would all grow up knowing when it's appropriate to go to an acupuncturist or a chiropractor or a physician. And so that's ultimately what I think we're headed for. It's just that that's down the road a ways.
I think we've dodged the whole issue. Well, I mean, we touched on it a little bit with efficacy, but I'd like, I'm an allopathic physician, and I have several friends in the Bay Area who are homeopathists and a lot of other things. And I'm pleased that this conference did not turn into an allopathic physician bashing. I think it's actually been a real pleasant surprise to me. But I think there's a natural tension that will always exist between science and belief. And I don't think that's ever going to go away. I think that research helps us with that. But some of the conference today, I got the feeling that I was being, in a crowd, and there was sort of a lot of cheerleading going on. And I understand that, and I'm sure my profession has done that. There were snake oil salesmen somewhere in our history, but I think that there's some of what we're asking today that is not ever going to be satisfying. There's death. It's going to happen to all of us. There's uncertainty, which will always exist. And I think we can all work together towards that. But my only statement in terms of a lot of the physicians who aren't here, the allopathic physicians, I think the major barrier is scientific evidence. And though I hear a lot about research and have asked from all the various practitioners that I refer to and get referrals from, I'm impressed at the paucity of that scientific information and also at the quality of it. And so I'm just going to put my 2 cents in that I think that the level of science, and you can say, well, that's not what we need, and I think there should be a lot of patient choice, and there's a real complex issue, but I didn't want that to be glossed over, because I think that's the major barrier, is from our point of view, is the paucity of scientific information that supports some of the things we've heard about today. So to the extent that, when I've been yelled at by chiropractors for not doing this, that, or the other, which happens at least several times per year, I say, send me the papers, and I never receive the papers. I say, give me a synopsis of the science that gives you, and don't make fun of the reductionist thing. I mean, you can make fun of it if you want, but that's the way we operate. And we are held to a standard that I think is very different than the standard that many of your professions are held to. Now, that may be a bias, but that standard is the scientific standard.
And thank you, and comments from our panel.
I'd like to respond to that. The New England Journal of Medicine recently published a really great study looking at the use of vitamin E in heart disease. Real positive, thousands of subjects, males and females. They divided them up. Women were studied. It was wonderful. And it showed that vitamin E works very well. The editor of the journal said very clearly, this does not mean that you should tell your patients to take vitamin E. There are other examples, but I'm too nervous right now to think of them. There is no lack of good science. There is a philosophical intransigence in the dominant medical field for interpretation. I'm sure that I can open the PDR to almost any page and find a drug that is in common use that has maybe 30 subjects looked at for maybe 6 months. And nobody argues with that. Nobody is unwilling to use those drugs. Well, that's not true. That's a big statement. Some people maybe are. But in any case, it's a lot easier to use a pharmaceutical drug that's been looked at in 30 people for 6 months than it is to get someone who is philosophically intransigent to prescribe or recommend 250 milligram or international units of vitamin E, because a very good, well-done study said that it makes a 36% difference in the mortality rate.
I'd like to comment on that exact study, because we talked about that last week at our journal club, which we do on a regular basis, and so we are not philosophically
And
intransigent.
would you stand so we can...
We talked about that study, but what I'm trying to say is that whereas you accept that based on one study, most of us are going to take that as one piece of information, and we're going to look at that over a period of time. And until there are, none of us do any one thing based on just one study. And most of us don't use drugs we don't use drugs there were only 30 patients looked at for 6 months. I mean, the FDA process is a lot more complex than that, so I think some of your statements are misleading in that regard.
I think that some of the things that Anne has brought up are the biggest problem for standard traditional medicine in terms of total acceptance. And I think that it is important for people to know and understand that. And it's important for us to understand the problems that people have in terms of funding, that they have a far more difficult task in developing studies than we do. There are a lot of levels of concern, and one of the levels of concern that I always have finally does come to an area within ethics, actually. And that is when we do see someone with, in my case, it's usually serious illness, I really do need the studies to tell people that this is what I recommend. I recommend that you take this drug. And I do that based on, in most cases, an enormous amount of information that has all been achieved through specific scientific methodology and compared trials, and some of those trials don't work out. So those things have to be evaluated really carefully, and it also needs to be understood that there is a lot of reality in illness and disease that is not examined through usual scientific methodologic mechanisms that are really very real and very important, and that as traditional physicians we have to pay attention to those. And there are a lot of things that have not been proven, which comes to my question to someone. I'm impressed that for an individual patient that I see, I'm always wanting to relate to them how I know that something I'm going to be recommending works, and expressing to them something about the studies. My feeling is commonly that doesn't make such a difference to the patients, actually, because a given individual patient, in fact, is not looking at themselves as a statistic, but rather as an individual, and they just simply want to feel better. They want to feel comfortable, and they want to know that the physician cares. So the transfer of that kind of specific science to them as a given patient is not so important to them as it is to us. That's my sense. Are there any patients that may wish to respond to that?
When you said that it's a matter of belief, I think that in my particular situation, there has to be a belief in science as well. I can look at my situation. 2 weeks ago, I had an episode where I was tracking along and talking and doing all this, and all of a sudden I started babbling. And words didn't make sense, and I didn't make sense to people, and people didn't make sense to me. And there were two distinct opinions. I got concerned, but I didn't get that terrible sinking feeling that my tumors had moved into my head and become brain tumors, now impairing my function. Some of my physicians thought that was the case. And I think had I just gone whole hog on the other side, I might have gone to bed and not ever gotten up again. As it turned out, the diagnosis was atypical migraines. And belief has an awful lot to do with how you manifest and how you deal with it.
About 3 or 4 weeks ago, there was an ethicist who spoke at the university, and he talked about healthcare reform. He said that there will not be genuine healthcare reform in our society until we as a society have engaged in a dialogue about death. And I thought his statement was really quite profound. And it speaks to the importance of education. It speaks to the importance of people talking to one another. And I think it suggests just how important this particular conference is as a starting point. And I want to emphasize starting point. My hat is off to St. Patrick and to the Institute, to Jan and to Stephen and to the others who organized this. And I simply want to applaud you because this is the kind of thing that we can do so well in this great community that we live in. Thank you.